The government has now approved the HSE's 2018 Service Plan, and our objectives as we go into the year are to ensure that we improve the health and well-being of the population, that we improve the quality and safety of our services, that we meet the changing and emerging needs of our population, use our resources as effectively as we can, and respond to unmet need in our community. We have a budget in 2018 of over 14.5 billion euros, which is 4.2% higher than in 2017, and that gives us opportunities to make some key improvements, but also brings with it an obligation to make sure that we use all our resources as effectively as we can. Examples of some of the new investments we'll make in 2018 include 9 million, for example, will go towards improving paediatric orthopedic services, particularly aimed at scoliosis treatments. 15 million euros to improve mental health services, 25 million to improve access to primary care services and to begin the shift towards primary care, which we all know we need to make. And there'll also be 10 million to improve access to respite services, bringing those services to more people than could otherwise avail of them. These are important steps in building a better health service, and this is the first service plan since the publication of Sláinte Care, which sets out an ambitious vision to be implemented over 10 years to bring about a completely different relationship between our health service and the needs of our population. New resources for healthcare are of course always welcome, but they come to us against a background of rising demand, increased costs of wages and wage agreements, for example, new costs for clinical services, and a whole range of other pressures driven by the needs of our community. And in that context, we have to make sure we use those resources to best effect. This year, we're putting in place a value improvement program. Value improvement programs are not unusual in publicly funded healthcare systems. And this year, we need to ensure that we use about 346 million euros less in order to provide the existing range of services so that we can provide more and better services. Every year, I ask everyone working in the health system to do more. I thank you for what you've done, and you do tremendous work every day. In 2018, I have to ask you to do that and to help us with the Value Improvement Programme to drive value where you can see opportunities. We have a fantastic workforce in the Irish Health Service who've shown over recent years what can be achieved. And I know that with your support and commitment, we can absolutely optimise the way we use our resources so that the people we serve, the people in our own communities, will gain from a better health service simply by utilising our abilities and our talents to do things better. So thank you for everything you've done in 2017. 2018 offers the prospect, with these additional resources and our Value Improvement Programme, of doing even more for the people who live in Ireland who need and depend upon the Irish Health Service. Thank you. So it just remains for me, as part of launching Service Plan 2018, to thank everybody for the work they've done this year, to wish you, your families and those you care about a really good Christmas. I know that many of our colleagues will be working through Christmas, and we appreciate that effort very much, as does all of society, and to look forward to a good 2018.